I'll share one. She's a nurse's aide. She works 12-hour shifts at an assisted living facility that the diocese runs. She knew she was in trouble. She was bleeding badly, bad cramps, terrible pain. She knew something was going wrong. She went to her supervisor and said, I think I may be having a miscarriage. And the supervisor said, can you make it through your shift? And she said, I'll try. She made it a couple more hours, and she did go to the bathroom, and she did miscarry. She sought medical help after work. She learned that she had had the miscarriage. She called work to tell them what had happened. Not only did they not ask her how she was, they expected her to return to work the next morning, which she did. And the reason she shared with us that she returned to work next morning is she knew it would be so hard on her coworkers. Where before there were 3 people taking care of 46 patients, she knew it would be 2 people taking care of 46 patients, and she knew she could not do that. I share that with you because there's a flip side of that coin.
Absolutely.
And the flip side of the coin is that we have a corollary non-religious based Catholic healthcare system in Western New York. It's called the Kaleida system, that face the same economic struggles, etc., essentially the same size, same number of facilities, a couple thousand more employees. They have about 10,000. They saw a problem with staffing 2 years ago, and they said it can't go on this way, because with staffing, the turnover rates are horrible, training costs are horrible, obviously patient outcomes are horrible, as is shown in studies. And they made a conscious decision to address it. And they addressed it by adding 134 more staff positions, which, importantly, they allowed the union to make the determination as to where they were needed, which is significant. So we have that example. The problem is that people flee the Catholic health system and go over there because over there they can function in their professional capacity. It is our truly prayer and hope that we will be able to convince Catholic health, and therefore the larger system of which it is a part, to take the same step.
Amen.
Knowing that they can remain financially viable by doing it, but by relinquishing a little bit of control to people, as the nurses say to us all the time, we know how to do it better, but we're not allowed to.